Good morning. I'm Carol Costello. Thank you so much for joining me. The World Health Organization, the WHO, says Ebola vaccines could be tested in the next few weeks in a few countries, including the United States. By January, those vaccine trials will expand to hard-hit West African nations where thousands have died. The Global Health Agency also plans to test experimental Ebola drugs in Sierra Leone, Guinea, and Liberia. Today's announcement comes one day after the CDC updated its own guidelines to better protect caregivers. One of them, of course, Dallas nurse Amber Vinson. She's currently being treated for Ebola in Atlanta. But before her diagnosis, Vinson flew to Ohio after getting the okay from the CDC. Vinson's mother, speaking out while in quarantine, tells CNN that in no way was her daughter careless.
She would not have placed her life at risk, first of all, just again being a caregiver, because part of what she needs to do is be healthy so she can help others. And you're right, also to not affect anyone negatively. And then being her mom, Amber would never do anything to negatively impact me.
Let's talk about all of this. I'm joined now by CNN national reporter Nick Valencia. He's in Dallas, and here with me, Dr. Devi. Now, I'm going to mess up your name again.
It's okay. Give it a shot if you want.
Nampia.
That's perfect.
Oh, see? Yeah. Good. Dr. Devi's with me. Now she's the assistant professor of anesthesiology and rehabilitation at the NY School of Medicine. Welcome to both of you. Nick, I want to start with you, though, and I want you to talk about these new guidelines. What are they?
Yeah, good morning, Carol. The CDC director, Tom Frieden, says that this will provide an increased margin of safety for those treating the virus, and it's all based on people who have already treated Ebola patients. It essentially boils down to three main requirements. One is repeated training or muscle memory and the donning and doffing, that's taking off and putting back on, the the personal protective equipment that these doctors will be using. Second is making sure that no skin is exposed during that process. And third is the buddy system. Having a trained monitor there during the removal process of the personal protective equipment. CDC Director Frieden says that the old guidelines clearly were not enough for Texas Presbyterian. Yesterday, though, we saw dozens of nurses from this hospital stand front and center in solidarity with the hospital. Meanwhile, today, Carol, is also a big day for 5 additional patients who are still being monitored for Ebola-like symptoms. I spoke to the Dallas County Judge, Clay Jenkins, and he tells me that he should have an update on their conditions and whether or not they're going to be cleared from this so-called watch list at around 10 a.m. Eastern. Carol?
Okay, is that you putting on the protective suit, Nick, that I saw in those pictures?
Yeah, actually, earlier this week, I was in Anniston, Alabama, where the CDC had instructors in Anniston, and they're training workers who are on their way, doctors, clinicians who are on their way to those 3 countries in West Africa affected by this outbreak. And a lot of it, as you can see, is repetition. It's muscle memory. They've had a lot of demand, too. These are doctors and nurses that are sponsored by NGOs here in the United States and are going to the so-called hot zone. Initially, this training was supposed to stop in January, but they've extended that because they've gotten so many inquiries. I asked them if there's a chance that domestic workers could perhaps have the same training, people here in domestic hospitals. They said that's on the table, but so far it's just for people who are going to West Africa. Carol?
All right, next. So, Dr. Devi, I'll ask you about these new CDC guidelines. So, it kind of seems like common sense. Of course, all of your skin have to be covered, so you have to wonder.
I agree. I don't think there's a big revelation there. I mean, I think it would be more helpful if they listed out actually where people are most likely to have problems. So for me, just having worked in the OR, we wear these shoe covers sometimes so that we don't get blood on our shoes, right? Mm-hmm. And so that we can dispose those covers. But it's actually very hard, even if you're wearing sneakers, to kind of wrap them around your foot and get them off. So a lot of times people will, stick one arm out literally and hold against the wall to pull it around. Well, if you do that, you might get something on the wall that could contaminate somebody else. So I think that having people who've done this, maybe in West Africa, who've seen where the problems are, using them as trained monitors would be more effective. And even with the goggles, now they've changed that to face shields, so that's changed. But still, if you think about doing these procedures, people have had this experience in the winter where it kind of fogs up. You're breathing heavily, your eyes are covered, and then it becomes difficult to see. So I would worry also about people doing procedures in this gear because there's more chance of maybe getting a needle stick or some other kind of accidental problem when you're not used to doing these things in this outfit.
So maybe the best practice would be to transport patients to the hospitals that specialize in treating such cases.
That's what I think too. I mean, I think it's important for people to know how to don and doff this gear because if somebody comes into their hospital, then at least they'll be prepared. But one other thing that I've been wondering, I mean, we've formed this strike team, the Pentagon has formed one. Why not have the strike team actually go to patients' homes as opposed to see them in the hospital? I mean, we know the people who are at highest risk are the ones coming from West Africa, right? So why not give them a sheet with a number to call if they have fevers? Then rather than potentially infecting people in the ambulance and along the way in the ER, why not have somebody kind of talk to them on the phone, find out what their symptoms are, and then maybe send the strike team directly to the house or the hotel to find out what's going on?
Here's the number to the CDC. Thank you so much, Dr. Devi. I appreciate it.